Throughout history, humanity has faced numerous deadly diseases that threaten the survival of individuals and entire communities. From the Black Death to smallpox, pandemics have ravaged the world, leaving behind death and destruction. While the medical community has made significant progress in reducing morbidity and mortality rates from various diseases, the impact of past epidemics and pandemics on human society remains deeply ingrained in our collective memory. In this video, we will explore some of the deadliest diseases in history and their impact on human civilization. Black Death. The Black Death, also known as the bubonic plague, was one of the deadliest pandemics in history, killing an estimated 25 million people across Europe in the 14th century. The disease is caused by the Yersinia pestis bacterium, which is transmitted to humans through fleas that infest rats. Symptoms of the disease include fever, chills, weakness, and the appearance of buboes, or swollen lymph nodes, around the neck and groin of the infected person. The Black Death's rapid spread was primarily due to a lack of knowledge about sanitation and hygiene practices during the Middle Ages. With no adequate methods of pest control and a lack of proper sewage systems, towns and cities were breeding grounds for rats, fleas, and other disease-carrying organisms. The devastating impact of the Black Death on Europe's population led to changes in societal norms, such as the abandonment of the feudal system and a shift towards a more urbanized society. Smallpox. Smallpox is a contagious viral disease that was once one of the most significant causes of death and disability worldwide. The disease is caused by the variola virus, which is transmitted through respiratory droplets or contact with infected bodily fluids. Symptoms of smallpox include high fever, fatigue, and a distinctive rash of raised red bumps that turn into painful pustules and scab over. Smallpox was responsible for killing an estimated 300 million people in the 20th century alone before being eradicated in 1980 through a worldwide vaccination campaign led by the World Health Organization. The disease's impact on human society was vast, with entire populations wiped out in some cases, such as in South America when Spanish colonizers brought the virus over. The eradication of smallpox remains one of the most significant achievements of modern medicine and stands as a testament to the power of vaccination programs. Spanish flu. The Spanish flu, also known as the influenza pandemic of 1918, was an outbreak of the H1N1 influenza virus that swept across the world, killing an estimated 50 million people. The virus was highly contagious and spread rapidly through urban areas, causing severe respiratory symptoms, including coughing and pneumonia. Unlike other outbreaks, the Spanish flu disproportionately affected young adults, with many of the fatal cases occurring in healthy individuals. The Spanish flu's impact on human society was devastating, with entire communities being shut down, and public gatherings were banned in an effort to contain the spread of the virus. The pandemic also spurred advancements in public health policy and research, with new disease surveillance systems being introduced to prevent future outbreaks. HIV/AIDS. The human immunodeficiency virus, HIV, first identified in the 1980s, has since become one of the deadliest pandemics in history, with an estimated 32 million deaths worldwide. HIV is spread through contact with infected bodily fluids, primarily via unprotected sex or sharing of contaminated needles. The virus attacks the immune system, leading to the development of acquired immunodeficiency syndrome, AIDS, a condition that leaves the body vulnerable to other opportunistic infections and can be fatal. The impact of HIV/AIDS on human society has been far-reaching, with the disease disproportionately affecting marginalized and minority communities. The stigma and discrimination surrounding HIV have further complicated efforts to contain the spread of the virus and provide care for those affected. COVID-19. COVID-19 is a recent addition to the list of deadly pandemics caused by the novel coronavirus, SARS-CoV-2. The virus first emerged in Wuhan, China, in December 2019 before rapidly spreading around the world, causing severe respiratory symptoms and, in some cases, death. COVID-19 has overwhelmed healthcare systems and led to widespread disruption to economies and social life. As of writing, the death toll of COVID-19 stands at over 3 million people globally, with many more affected by long-term health complications. The pandemic has highlighted the interconnectedness of global society and the critical role of public health interventions in preventing the spread of infectious diseases. In conclusion, while modern medicine has made significant strides in the prevention and treatment of deadly pandemics, the impact of past epidemics and pandemics on human society remains undeniable. From the Black Death to COVID-19, these diseases have shaped the course of history and influenced societal norms across the globe. As we continue to learn from the past and adapt to the ever-evolving threats of infectious diseases, it is crucial to remain vigilant and proactive in our efforts to protect public health.